Hi, I'm Dr. Kivett, board-certified plastic surgeon and dermatologist in Santa Rosa, California. I'd like to speak today about a condition called actinic keratosis. Actinic refers to the sun. Keratosis is simply a fancy Latin term meaning skin bump. Actinic keratoses develop wherever a person has had sun exposure. They're caused by years of unprotected sun or partially protected skin from the sun and from tanning beds. If you look at actinic keratoses, they are actually declared by most governmental agencies as being benign, but generally considered to be spots that can result in the development of skin cancer, maybe 5% or less. If skin cancer develops and early on these areas are treated, then it's just fine. The way that you detect them is that if you see pink spots on the skin, and then also if you can just simply rub your fingers, the sensitive part of your fingers, across the skin and feel like a little bump sticking up that catches on your finger ever so slightly, that is what an actinic keratosis is. What makes it a little more difficult is that those little scaly bumps that sit on top of those areas will then fall off, and then a few weeks or a few months later regrow. And in that situation, that helps support the diagnosis. They can simply be rough, scaly patches too, or thick growths that have a variety of colors. Sometimes they're painful, particularly if they rub on a necklace or a wristwatch. Sometimes they grow rapidly, and if they grow rapidly enough, a person gets a hard, thick, pointed, calloused thing that we call a cutaneous horn. And in fact, that represents keratin from the outermost layer of the skin, which is a protein type material that actually is the core of nails and talons and horns that you see on humans and other animals. They're found mostly on sun-exposed areas. Occasionally you'll have other areas where they appear, but it's mostly scalp, face, tops of the ears, back of the neck, on the dorsum or the top of the forearm, as opposed to the volar aspect or the bottom of the forearm, where the sun doesn't routinely shine because of the way we hold our arms in regular life. They can disappear for weeks or months at a time and then come back. If one of these starts to bleed, then it's presumed that the few cells that are in these spots that are a little more aggressive may start to form true skin cancers and then grow downward and erode into tiny capillaries or tiny blood vessels that exist in the upper layer of the skin. Rarely do we see these in people under 40 years of age, although with a significant tanning bed history or in some genetic conditions where people do not have the ability to heal themselves, such as in a condition called xeroderma pigmentosum, do they appear. The diagnosis is made usually visually by a skin specialist and sometimes other doctors. If a biopsy is needed because of the thickness of it, then one is done, but they're not routinely biopsied unless there's a suspicion that maybe the growth has, in the 5% of total range, extended itself and become more of an early skin cancer rather than a what we call precancer. Treatment of these is highly variable, but they are highly treatable. A cold spray can destroy them, scraping can get rid of them, There's other kinds of light treatments and chemical peels that are used, and laser skin resurfacing can make a difference too. One of my favorite methods, besides simple destruction, is to realize that these do not arise in the sea of normal virgin skin. That is to say, if you have a spot, usually they're accompanied by 2 or 3 others, and usually this skin is not normal. It's not like a baby's bottom. It's usually skin that has been exposed. And if a scalp is a bald scalp, that's even more reason that you're going to see these. One of my favorite ways to get rid of them is to use a cream that has been around since, imagine, the early 1970s or so. It's been a long time since it's been around and has treated millions of people. I've treated several thousand people with this particular cream. And what it does, you have to consider it to be something like weed killer. The weed killer, think about it. You go in the backyard, you sprinkle the powder, the grass stays intact, but the weeds die. Some people think, whoa, the cream must be like a battery acid in a cream that destroys everything, and that's simply not true. In that analogy, it'd be like going in your backyard to kill the weeds with a flamethrower. And so not only do you kill the weeds, you kill the grass too. What's particularly good about this cream is that it inflames only these precancer cells, and in so doing, turning them pink, it destroys them. And what happens is that these cells are slightly faster growing than normal skin. So normally, normal skin does not become affected by the cream. It's only the faster growing cells that uptakes this particular medication. And the medication involves attachment in the laboratory of a really reactive fluorine atom to what's called a uracil, one of the DNA base pairs. And when that's pulled into the growing cell, the cell simply comes to a halt. And it just sits there. And then your own immune system, which is continuously surveilling for bad things, whether they're splinters or strep infections or cancers or unusual cells or oddly growing tissue cells, will destroy selectively those cells that have pulled this particular cream component into them. And so it's very selective, and that's what I like about it. There are a number of other chemicals on the market since the 70s that have been used to cause a generalized immune reaction. So wherever that cream or that solution has been put, the medicine turns the whole area red, inflames the entire area, with the thought that this unfriendly fire, if you will in fact destroy the actinic keratoses. So the specificity of the treatment, this cream, in my mind, is very beneficial. The goal then of the cream is to turn the skin pink. I wrote the book on the subject. I'm glad to share with patients the guide that we give to each patient. And so if you put the cream on for the 6 weeks that's recommended per the literature and nothing happens, then it means you don't have any precancer cells. If, on the other hand, you get 20 little dots in the area that you applied the cream, then that's 20 little areas of cells that are dying because your immune system has seized on them because the cells have been brought to a halt, and now the immune system is clearing out your system from those particular cells. If, on the other hand, the skin becomes highly red, and if you dial the name of this cream, which is called Effudex or 5-fluorouracil, into Google and search, you'll find all these pictures of people with bright red, oozing and weeping and dripping reactions to the cream. that aren't necessary. Not necessary to have that intense a reaction. It certainly works, but it doesn't work any better than just having the skin inflamed with a little pinkness and a little fine scaling, like you'd experience with a very mild sunburn. And so, if you can treat the areas where these spots are present under the doctor's direction, then that will help a great deal prevent other skin cancers. I like to treat patients regionally, namely in symmetric areas, like the entirety of the nose, both cheeks simultaneously, both ears simultaneously, the forehead, the area around the mouth, the neck, front and back, tops of the hands and arms, each separately. Because, again, this is not a battery acid in a cream. This is an immunologic attack against just the cells that identify themselves with the cream. Of course, this is cancer chemotherapy, but it's not absorbed into the tissues. There are very few examples of true allergy to the cream. And it is still, to this day, used intravenously in the veins of women with ovary cancer. So it does work as a cancer chemotherapy, but it does nothing when you use it as a cream beyond the regular skin. It doesn't cause hair loss. It doesn't cause a change in your blood count. You don't feel sick to your stomach. None of those kinds of things. The studies also show that if you use it for 6 weeks, as opposed to 2 weeks, 4 weeks, or even 12 weeks, the ideal duration of usage is 6 weeks. Meaning, what happened to those people 3 years later in terms of cancers growing back or other cells growing in the area. So after I do a number of surgeries on patients for other conditions, whether Mohs, skin cancer surgery, or other things, then I always like to use this cream after the wound's fully healed, because you have to imagine that cancer growing in a given area does not do so in normal skin. It grows in abnormal skin. So it would be nice to go ahead and destroy all the other wannabes that are going to try to grow, the baby and the precancers, so that patient, you don't have to keep coming back in here over and over again for more and more surgeries. It works nicely that way. So it'd be worth considering for cleaning off the skin generally, even before cancers develop. And I'll have to say that, in truth, I'll have a patient sitting in a chair, and then his wife will be sitting right across from him, and she'll say, I really like what it did to his skin. Can I have a little for me? We're not doing it for cosmetic reasons, but when you think about aging skin and skin that just doesn't look too good, removing existing precancer cells, which affect the appearance of the skin, has to improve the appearance of the skin. So when you look at what our goals are, we can have a separate discussion about sunscreen and wearing a hat, wearing sleeves, not going out between 10 and 4 in the afternoon, using an umbrella, and so forth and so on. That's preventing future damage. What this cream does is it takes existing damage and reverses a great deal of it. So it's worth considering. And so if we can help in any way with other advice, please let us know with a question or comment below. Please consider subscribing to this channel, because we can help more people that way by having such subscriptions. If you like what we did, give us a thumbs up. Tell your friends about us. And always be safe. Thank you. Take care.